Today, I'd like to address a question that Carol sent me about what kind of therapy she should do. Now, I know a good deal about therapy, and I'd like to just tell you that I would like to say I have brought a few things to show you. This is, for example, what you get in talk therapy, in my experience. You get this in talk therapy. This is, get some superficial. If you're lucky, you get some superficial dust up. Now, if you have a better therapist, your talk therapy will be more like this. This is a spin mop. If you get real lucky, because not all the therapists are all that smart, you'll get yourself somebody who's as efficient as a spin mop. Now, I don't really have one to show you for this process called focusing. It's FOCUSING. That's what they call it, but that's not a good name for it. You drop into your body and see what your body is thinking about what you're doing in your life. For example, Jim, I think it was, who wrote to us last week about that girlfriend who was found in his glove compartment after he'd just taken her to dinner. Now, if he drops into his body and spends some time in there, what might his body be saying about that girl? It's not an efficient use of his time to continue to see her. Certainly his body would say that. It might have some, going on or some going on or some jumping up and down, or he might see some image that's more like, he's drowning because he doesn't know what to do. That seems a little exaggerated. What I'm saying is, I don't even have a tool to show you what focusing can do, because focusing can drop you into your body. I do have a tool to show you what EMDR can do. Hold on, I've dropped it. Eye movement desensitization and reprocessing. That is something that is, this is an electric tool that reminds me of that. Let's see if this thing it's run out of juice. I don't care. Do I care? It doesn't matter. It makes a big noise. And it scrubs real hard. It scrubs real hard. You'll never get this with talk therapy. And focusing actually is superior to what you get with this. This is kind of, your mop on steroids. It does a real good job on your bath. See, mine's got hair on it because I've been doing a real good job. That's the puppy hair. Anyway, here's the thing. It does a real good job. What you don't want to do is grind down this tool here into you don't want to be taking the enamel off and thinking that that's somehow benefiting you. You don't want to just scrub the enamel. You want to have some, I don't have time to discuss what could go wrong. I don't. A lot of things could go wrong. With focusing, nothing goes wrong. With talk therapy, you're dependent on the talk therapist, and a lot can go wrong. With EMDR, you can just grind this down until you are taking the enamel off the tub, or you are scratching the floor. Hard to imagine, but you can do that, and just don't. Just don't. I've done it. Don't do it. Focusing is what I recommend. Just getting familiar with how you feel. Everyone's so afraid of drowning in feelings. Muscle up. It's not hard. You can you can go down into how you're feeling and kind of sit on the side of it and just take your time, stick your toe in it. No need to be afraid of it. No need to sit in the center of it. No, you're not going to be flooded by all those feelings. I haven't got time to discuss it anyway. Get some courage, and that kind of thing is going to help you not go out with girls who get into your glove compartment.